Hello and welcome everybody to today's Lunch and Listen. My name's Sue Hinds and I'm one of the services team at Dementia Carers Count. And today I'm joined by a very good friend of Dementia Carers Count, and that's Dr Gemima Fitzgerald. Gemima is a clinical psychologist with a very strong interest in building resilience and well-being. So Gemima, welcome to the latest edition of our Lunch and Listen. Thank you so much for giving us your time and being with us today. Would you like to tell our viewers a little bit about yourselves and what you'll be talking about today, and perhaps why as well?
Okay, thanks, Sue. Yes, thank you for having me today. It's so nice to be here talking to you and knowing that hopefully there are people watching that this might be helpful for. So I'm a clinical psychologist. As you've already said, I've got a real strong interest in resilience and well-being and helping people through challenging, to say the least, times, which obviously we know, being a family carer of someone with dementia involves a lot of difficulties, some highs as well and some lows. But today we really want to focus on grief, and that's something that in our culture we don't always feel that comfortable talking about. And the reason we're talking about it today is that actually talking really helps. And grief isn't something that's just associated with bereavement after somebody dies, but it's also, particularly in relation to dementia, something that people can experience during the process of caring for someone with dementia, as they feel that they're getting a sense of loss and that so many changes are happening. A lot of people, they don't always know that they're experiencing grief at the time. Sometimes it's about noticing it after the event, but that's why sometimes it's helpful for us to think about it and think, actually, is that what I'm experiencing? And if so, what can we do? What can I do? Is there anything I can do to help myself with that?
Thanks, Gemima. And I'm really glad you brought up that point, actually, that grief isn't just after somebody passes away, that we can experience grief as things change, particularly if you're supporting somebody with dementia and relationships are changing, skills are changing, abilities are changing. And as you say, it is sometimes quite difficult to recognise or identify that that's what's happening for someone. So thank you for bringing that at the start. We do, if you're listening to this, put questions into the chat for us, make comments on anything that Gemima and I discuss, and if there are questions, we'll try to come to them through this session. I think, as Gemima says, this is something that isn't often talked about a great deal, so the likelihood is we might get quite a few questions in the chat. We will get to as many of them as we can during this session, but if we don't get to all of them, we will be looking at them afterwards, won't we, Gemima? We will go through them and we will respond. So it might not be in the moment of this 30-minute session, but we will come back to them as well. So, and it's something that can be quite difficult to talk about, can't it? I think we've both had personal experiences of it. It's quite difficult to talk about. It's also sometimes something that's quite difficult to recognise and to identify the signs and what might be going on. And I'm wondering if you could sort of give us some insight about how you do identify grief, because it looks so different for so many different people.
I think, yeah, I'm glad you said about that we've both experienced losses, just as for disclosure purposes. I don't know if this helps people to know, but my husband died less than 2 years ago, so I really do have an understanding of grief. It doesn't mean I know how it feels for the people listening, of course, because as we're saying, it is so individual. But with grief, what we know is that it involves a whole wide range of emotions. So we can't say that grief feels like sadness, or grief feels like shock, or grief feels like anger, or grief feels like disappointment, but it's all of that stuff and so much more. But what we know is that if you're having a major change, or you're going through a major change in your life, then that will involve loss. So that change can be because somebody has passed away, has died, but it could be that someone has had a diagnosis of dementia. Just getting that news is very shocking and can trigger some grief. But also anything, even if it's a positive change in life. So for example, you get you decide to move house, and you're moving somewhere you really want to move to, and you're really excited about that move, and moving day comes. That can also feel really sad because you're saying goodbye to the old house. Or even if you've hated living in the old house and you cannot wait to move because it's been nothing but awful there, still the moving process can trigger feelings of grief, because you're looking at it and thinking, oh gosh, I'm remembering all the awful stuff as I'm moving into the new house, because I'm saying goodbye to the awful stuff. So it doesn't matter whether it's a positive change or something that's really difficult. Loss is associated with grief of some sort, but obviously when we're talking about the loss or the losing process with dementia of a loved one, there is nothing more painful. There is nothing more painful. So I think if you're identifying as a carer of somebody with dementia, that you're feeling that, you know, something different about you, you know, maybe you're more emotional, and by emotional that can be happy, sad, relief, anger, you know, all sorts of emotions, then if that's a change in who you normally are, then that's quite likely that you're experiencing some sort of grief. And I would just suggest that you stop and pause and reflect, you know, rather than just thinking, oh, I'm losing my temper all the time, or I'm really irritable all the time. Okay, well, what's underneath that? What actually is going on? And sometimes, especially when we're caring, it can be so busy and so fraught that it's difficult to have those moments to stop and think, actually, what's underneath this anger, or what's underneath this irritability, or this tiredness, or, you know, what am I actually feeling deep down? And often that can be grief. And grief is something that comes often in waves. It's situational. So for example, with grief, you might be out with your friends, maybe you're having a lovely day and you're having a really nice time with your friends and you're happy. Then, you know, and that's really normal with grief, but then maybe something will trigger you. Someone will mention the person that you're caring for, and suddenly it all comes flooding back, and you suddenly feel this utter sadness or fear or whatever it is. That's grief. It comes in waves associated with reminders, triggers, situations. Does that make sense?
Yeah, absolutely. And it's really interesting you use the word waves, because we also know on an ocean, no two waves are the same, are they?
Yeah.
So it doesn't always necessarily feel the same for you. It can be quite different. And Miriam has posted in the chat saying that anticipatory grief is massive around dementia, and it's something that's not openly talked about. Similar to when someone has a terminal prognosis.
Yeah.
But anticipatory grief, that term, I think that term is around a lot more now, but that's what you're talking about, isn't it, Gemima? Just to clarify for people.
Yeah, that's exactly it. So, you know, most people in the general public think of grief as being something after somebody dies, something you experience after someone has died and you feel their loss. But anticipatory grief is that loss, you know, particularly in dementia, but as Miriam said, also when someone gets a diagnosis that is terminal, it's that feeling of what's to come. You know, it's you often start the grieving process straight away. And lots of people who are caring for someone with dementia might say, I feel like I'm losing them, or I feel like, you know, they're still with me, I still love them, or I still have strong feelings for them, whatever they are. Maybe they don't love them, maybe they're really angry with them, or maybe it's complicated and they have mixed feelings. But either way, that the things are changing, and maybe there's some grief around losing aspects of that person, losing aspects of the life that they have, the relationship that they had together, things they used to do together. You can grieve, oh, we used to love going to the pub together. We used to love that, and we don't do that anymore. And I'm grieving for those bits. Or I used to love the fun that we used to have, and we don't have that anymore, or not as much. Or grieving because of a fear of what's going to happen in the future. And it's in some ways it's different to when someone has died. It doesn't mean it's harder or easier, but it's different in that there's no end date. You know, there's nothing, or there's this often a sense of impending doom that people can feel of, oh gosh, what's to come? And that can be really frightening. And often people feel exhausted by being a carer too. So there's the added layer of, not only am I feeling this grief, but I'm also exhausted and scared. And so it can feel really complex.
Yeah, and I think you've touched on it there as well. There's also the grief about what you had planned and perhaps isn't going to happen now. Those future events that you'd had planned together that perhaps won't happen. I've got one of the things I want to ask, what we are going to do within this session as well is shortly move on to some of the strategies, some of the things that you can do to help manage your feelings of guilt, grief and loss. But I've had a couple of questions coming in. The first one is a direct message from somebody who says, they feel, let me just read this so I make sure I get this right for you, Gemima, who feels that they have to hold everything together because if they do start crying, then they won't be able to stop and they feel they're not going to be able to keep in control. Is that something you've come across yourself?
Do you know what? That is something that I hear so often, is people telling me that they're scared of giving into the grief or letting the grief in some way, or scared that, yes, if they start crying, they'd never stop. And then that's a really real fear for so many people who are grieving. And what I would say to them in that situation is, it's a bit like thinking of grief as like I read this somewhere once, that like you're in your house, you're in your home, and you've got your front door shut, and you think that there's a gang of thieves and awful people standing at your front door. And if you open the door to all these different gang members, they're going to come flooding into your house and overwhelm you, and you won't ever get rid of them. And that's how often people think of grief, as all these different emotions, as like the different gang members. And actually, it's not like that. It's not like that. But if you think it's going to be like that, then that's terrifying for people. No wonder they feel that they better hold it together and bottle up their feelings, or else that they will cry and never stop crying. The reality is that all things pass. And if you do cry, and if you do just say, I'm just going to sit and actually think about how I feel right now, and feel how I feel, and allow myself to be whatever I feel right now in this moment. It could be sad, it could be angry, it could be anything, but I'm going to not resist it. I'm not going to distract myself. I'm just going to sit with it. Then it will pass. It might feel horrible. You might cry. You might cry. You might cry for half an hour. You might cry for 3 hours. But I absolutely guarantee you will stop. No one, all things pass. And most people feel a hell of a lot better when they've had a cry. It's a bit like a storm. And, the feeling the next day after a storm, actually, it feels a little bit fresher. Just that little bit like, oh, most people feel a sense of relief after they've allowed themselves to cry. What we know is that it's really bad for us physically and mentally to bottle up our feelings. The meaning, if you think of the word depression, what is that word? That is about depressing, pushing down feelings, and it doesn't help us. It's a strategy, and sometimes it's a strategy that works for a bit, but you can't not grieve. You might delay it, but you can't put off the inevitable. What you've been through will either start affecting you in your body if you don't face it psychologically, or eventually it will overwhelm you. So you're better off if you can, and it is quite courageous to do this, to actually just accept that, do you know what, I'm a human being, and I'm allowed to feel sad, or I'm allowed to feel, I'm allowed to feel.
Yeah. I think, I've worked with you many years now, Gemima, and you've been our specialist on resilience and well-being since we first started ever doing services. And I think one thing I learned from you very much so, and it feeds into what you just said then, and things that you were saying before about how you identify something as being grief, is self-compassion. And I think that's what's really important there, in allowing yourself to have those feelings, and allowing yourself to sort of lean into it almost.
Exactly. Because so many of us are so hard on ourselves, and so especially carers, you're caring because you are a caring person, or you are being forced into a caring position, but either way you're caring by very definition. So often we put other people's needs before our own. So the fact is that if we can just stop and allow ourselves to treat ourselves in the way that we would treat other people, that's so important.
And it's really lovely to hear you saying all this, Gemima, because there's messages coming in here from Liz, Marie, Julie, Sarah, and a lot of them are beginning to identify with some of the things you're saying, and beginning to lean into saying, oh, actually, is this, for example, you know, Julie is saying she's been feeling feelings of terror and panic for no apparent reason, and she thinks it's beginning to understand it a little bit more as to why that might be. So some of those identifying with the grief, and then sort of giving yourself compassion. Liz is sort of saying that she feels like she's a widow in waiting, and how hard that is. So it's having that self-compassion for that as well. So it's really lovely to see people are leaning into it a little bit. Although Sarah, on the other hand, she said, I struggle with the opposite. I can't cry. I can't seem to get there. I feel beyond that now.
And Sarah, thank you for saying that, because actually that's something I forgot to mention, is that grief sometimes is about feeling completely numb. You know, so not being able to cry is so common, that there's nothing wrong with you. That's really normal that you feel like that. It can be quite scary feeling like that, because I think it sometimes is a bit of a survival strategy to sort of almost detach. It's not something you're consciously doing, but it might be something that you're doing in a sense to survive something that's so difficult. So it's okay. Take the pressure off yourself, is what I'm going to say. I think you know, it could be that you don't cry for a long time. It could be that you never cry, but it doesn't mean you're not grieving. I can guarantee you that, you know, sometimes we can feel incredibly sad, like your heart is going to break, but no tears come. And that is still grief. So please don't feel that tears are what validates your grief. It's not that at all. It could be that all you feel is anger, or it could be you know, something else.
Thank you, Gemima. That's really, really helpful. And Sarah, I hope that was helpful for you to way. We are halfway through. In fact, we're over halfway through, Gemima, and I do need a couple of minutes at the end to tell people what's coming. So if it's okay, I'm going to move you on now to some of the strategies that can be used for managing guilt, grief and loss. And Miriam has said as well that that on many forums it's commented on grief, and that there's often a difference in different partner or parents, or if it's a family member, or whether it's a friend. So any strategies which can be shared are brilliant, because different strategies might be used in different scenarios. So have you any thoughts on strategies?
Yeah, I think it is different if it's a partner compared to if it's a parent or a, you know, whatever the relationship is. But it's not necessarily, and it's different on so many levels, isn't it? It's different because of the role that person played in your life. So if you, for example, if you've lost a partner, husband or a wife or a partner, then that might be something, you know, a big loss around future plans, also about what the life that having someone to come home to every day and talk to every day. If it's a mum that you've lost, it might be about, oh, not having that person that's always there for me on my side. You know, it's just different. But in terms of strategies, the first thing I would say, and I know we've already touched on it, is about self-compassion. 100% learning to be kind to yourself. Don't beat yourself up that you should be feeling a particular way. Grief is individual, and however you feel is very, very normal, because there is no perfect way to grieve. I would also say, try and find somebody to talk to. So, and that's about finding the right person. So sometimes, you know, some people just aren't good to offload to, because they try and cheer you up too quickly, or they just can't handle it. And so, but some people are better at listening. And I would think when you do choose your person to try and talk to, if you do have somebody, then I would suggest that you frame it in a way. Sometimes it's helpful just to say, look, I need to talk to you about how I'm feeling, and this isn't something that you can fix. I'm not expecting you to fix it. I'm not expecting you to give me loads of advice, but if you could just listen, that would be really helpful in itself. So then it takes the pressure off the other person to try and come up with all these quick fixes of, oh, why don't you join a gym and you'll be fine, you know, that kind of suggestion that maybe isn't going to be that helpful. Definitely having, you know, and this really does depend on who you are, what kind of person you are. Are you somebody who thrives in, you know, going for walks on your own and just having some alone time? Could you find a way of doing that? Or are you somebody that you really get your you know, a benefit from being around friends or doing something a little bit more social that just distracts you a bit? So and I probably would suggest having a balance in there. I really think having, and I know, you know, Sue, you've talked about this a lot before, but doing some nice breathing exercises, I think, is absolutely brilliant. I do that so much in my own life. It just forces you to kind of stop, pause, and just take a moment out of the crazy busyness of life, just to wind it down, just slow down for a moment, take some nice deep slow breaths. So I think that helps. For me personally, being in nature is absolutely life-changing. You know, I need to be out there, you know, even if it's just, you know, just for walking my dog, just being outside in nature in some way, you know, whether that's a park or you know, or wood, or being by the sea, or wherever it is, but just being able to get out in fresh air. We know that being around the colour green is really therapeutic and actually boosts our mood. So any of that stuff, I think. Sorry, one more thing just to say, if you think, you know, we haven't really touched on this yet today, but if you feel that you might be depressed, I would say go to your GP. That's really, really important. But you know, depression and grief aren't the same. You know, with depression, you know how I was saying earlier that you can be with your friends and feel better, and then something triggers you and you feel worse, and it's a wave. That's grief. Whereas depression is much more stable. I'm low all the time, and it's not. But those two things are different. It doesn't mean they can't coexist. You can be grieving and depressed. You can be both.
I think that's quite important, isn't it, Gemima, yeah, that you can be both. And maybe we invite you back for another lunch and listen on that subject. That would be really useful, because I'm afraid I am going to have to start winding this up, I'm afraid. And I could sit and talk to you and listen to you about this for far more than half an hour, but I'm afraid only half an hour we have. 3 things you picked up on there I think is really important, is about choosing the person you talk to, frame actually what you want from them, and those breathing techniques and being out in nature or green spaces. And one of our last lunch and listens was with Andrew, another of our associate practitioners. For any listener who wants to go back and listen to that one, he talks quite a lot about the breathing and green spaces. Have a listen to that one as well. You can always go back and listen to the pre-recording. And there's lots in the virtual carers centre. As you say, we talk quite a lot about the breathing and the breathing tools, don't we? So just before I give you the final words on this session, Gemima, and I feel really sorry I've kind of pulled you short on a few things, but thank you so much for joining us, because it has been a really insightful session, however short it's been. And we haven't covered it all, obviously. If anyone would like any one-to-one support, though, please pop your details in or email us. We'll put our email address in the chat box for you. And please do get in touch with us, and we can have a chat about what sort of services would be useful to you, and what, you know, and perhaps in what ways we can help you as well. Next Thursday, we have another lunch and listen. We're on a real roll with these lunch and listens now, aren't we? And we're being joined by Gina Howard, and who is an author and illustrator of her book Tony Husband, and they'll be discussing the new book United, Caring for Our Loved Ones Living with Dementia. So if you can, pop the kettle on and put your feet up to come and listen to that one, spend half an hour with us next week. Do carry on putting messages in the chat. I know we've had a couple more coming in, and I haven't had chance to get to them. The one about the puppy being in the house, being the beating heart of the house, is drawing my eye over to the other side of the screen. But thank you, Gemima. What I'd like to say is, Gemima, you've got a few minutes just to pick up any last strategies, because I've done my bit, so it's over to you now for the last few minutes.
Yeah, I think if I could say anything to finish with, it would be talking about acceptance of your emotions. So don't judge your emotions. So often, you know, a bit like we were saying about people being scared of feeling sad or feeling scared about crying, people are worried that what that will mean, or if I feel this thing, or if I allow myself to feel guilty, or if I allow myself to feel whatever it is, then something else bad will happen. And I think if you could just not judge those emotions, don't just accept that they are a part of a process. What we know about grief is that it will change you forever. You won't ever be the same. I can't say that life is ever going to go back to how it was before, because you're going through something huge. And I know from personal experience, losing, having the death of a husband, I will never be the same. But life can be incredibly rich again and incredibly full of joy again. It will just be different. You will grow as a human being. So try and hold on to that hope as well, that something, I love, there's a poem by Mary Oliver, and she said, someone I loved once gave me a box full of darkness, and it took me years to realize that box was a gift. And there is something about knowing that you can go through the absolute worst of times, the most devastating of times, but you as a human being can get through this and will have something much richer about you as a person. You might not see that at the moment, but you will have so much more to give, and you will see life differently. And I tell you what, I appreciate life more than I've ever appreciated life. And I hope that people listening, if they're not there already, will get there one day. There is some positivity in it. There is some hope within it, but it is challenging. It is hard. And I would just say, just reach out for help, reach out for support, talk to people. You are not alone. Most people, as we said right at the start, go through grief at some point in their lives. It's part of the human experience. So don't think you're going through this alone. It might be different for you to what other people are feeling, but other people have felt it too. And yeah, my heart goes out to you. And as for the puppy comment, 100% feel that. I got a dog actually just before my husband died, and so thankfully I had her, and she was an absolute joy and remains an absolute joy in my life.
And I think what Liz is saying is the puppy is in the house, and her husband also is able to really connect and have a relationship with the puppy as well. So not only after death, but also when there's that anticipatory grief going on as well. Mm-hmm. So I think I'm hearing you saying, talk to people, choose who you talk to carefully. Yeah. Show yourself some self-compassion, give yourself time, some compassion, mm-hmm. Use some of the strategies that you've talked about. And another comment that you made quite early on that really sticks with me, which will be my final comment, and then I think we'll say our goodbyes, is there's no perfect way. There's no one way of doing grief, and it's individual for everyone. And nobody has the right model for how to grieve or anything like that.
Grief, absolutely, it is completely individual, and we know that with grief it's like a pendulum. So if I do this in my hand, you swing one way and then you go back into feeling better. So mostly when you initially are experiencing that anticipatory grief, or you might be feeling the grief feelings an awful lot over time, and it can take a long time that you swing more into the feelings of restoration and hope, and life goes on and moving forward. That your pendulum can swing in one day several times, but over time you will spend a lot more time feeling more hopeful, and feeling stronger and more able to go forward in life. But yeah, it's going to take some time, and just be kind to yourself as you go through that process. Yeah,
and so it may feel 3 steps forward, 2 steps back, but it will move forward.
It will, yeah.
Thank you so much, Gemima. It's been a real pleasure to spend this half an hour. I'm sorry it was so short. Any other questions anyone has, any comments, any thing they'd like to talk to us, please put it in the chat box. We'll also put there the links to our virtual carers centre where you can find the breathing work, and also get in touch with us if there's anything you would like to talk about around one-to-one support on the topic of grief. Thank you again, Gemima.
Thank you.